And joining me now with the latest updates on COVID-19 is our Medical Officer of Health from the Eastern Ontario Health Unit, Dr. Paul Roumeliotis. Welcome, Doctor.
Good to be back.
So, Doctor, right now, within the entire Eastern Ontario Health Unit catchment area, we're looking at 92. Cornwall still sitting at about 14. So, first off, your thoughts on those numbers?
Well, first of all, we had a bit of a jump over the weekend. We were in the 70s, on Friday, and all of a sudden it went up to 92. And just want to reassure whoever's listening now, particularly in the Cornwall and SDNG area, that those numbers went up because we had a long-term care facility in Plantagenet that had 11 cases. There were 8 residents that we tested positive and 3 staff that were working there. They were all asymptomatic. They had no symptoms. So those are the 11 that were added. If you take away the 11 that we added that were in the long-term care facility, our numbers are going up, a couple a day, which is really nice to see. It tells me 2 things. One, we still have activity, but the activity is increasing at a very slow pace. So we're seeing a flattening of the curve anyway. But it still doesn't give us the message that we should stop social distancing and our public health measures. Time will, the light is at the end of the tunnel, but we're not there yet.
Absolutely. And when we talk about long-term care homes, we know that both at a local level, provincial level, and a federal level, that is still a major concern. So let's talk about some of the measures that are being put in place, like testing and protective measures, to make sure that all of our long-term care homes in the area are being protected.
Long-term care homes have tragically been really victimized here. Half the deaths, not only in Ontario but across Canada, are in long-term care facilities. So we have to make sure that we are protecting them as much as we can. It's not surprising because tragically, if you see the death rate, it goes up beyond 65 years of age, and it's like 20% or 25% death rate in 90-year-olds. So it's not surprising that those individuals, once they get infected, have a high death rate. So it's creeping into them. So the first thing I tell people is we got to decrease it in our community so there'll be less creeping into those facilities. But secondly, what we're doing is we're across the province, and specifically in our area, we have a specific team now just dedicated to long-term care, retirement home, and other congregated livings like lodging homes and group homes. And we're working on a daily basis with each and every one of them to ensure that they have the proper personal protective equipment, infection control procedures, even staffing. And now like I said, we've tested that one, and now we're going out to test. We have a rating system, the ones that are high risk and so on, and we're testing those as we speak. And we're working with our hospitals as well to be able to provide them any additional support that they would need. So that is really very, very high on our radar right now. We're trying to focus on the long-term care facilities because, again, they are the biggest victim to this COVID, and it's a tragedy. And we want to, and in our area so far, we've got one, knock on wood, one outbreak, and I hope and we're limiting it right now. We're doing all the necessary precautions at that home in terms of protective equipment, isolation, and so on. And until further order, all of our long-term care facilities, we have 18 in our area, are going to remain locked down. No visitors, strict testing protocols, strict screening of the staff, strict screening of the residents on a daily basis to ensure that we protect those most vulnerable in our community.
And we know that's absolutely the priority, is protecting those most vulnerable. Now, last week, Doctor, we saw the province of Ontario updated their projections. Today, we saw Dr. Tam and the federal government updated their projections, and the curve does seem to be flattening.
I think the curve is flattening, and so that's the good news. The bad news is that it's going to take a while for us to get out of this completely, but at least we're heading in the right direction. And so, Dr. Tam and all of the other projections, the Ontario projections, also put us in kind of compared us to worst case scenario like Italy or United States, for example, versus best case scenario like Singapore or Japan, where they have lower cases. And I'm happy to say that we're closer to the better scenario. So in terms of the number of deaths, the number of hospitalizations, the number of cases, we're closer to the best case scenario and far away from the worst case scenario. So I think it's a testament to the work that we've done collectively to socially isolate, take all the necessary precautions, lock down, because the lockdown paid off, I think. Look what's happening across the river in New York. They've got close to 60,000 deaths, more than 1 million cases in the United States, almost a quarter of those in New York, which is right across, you're literally the river, right? So I think we've done a good job, but we need to contain and sort of keep that course going on. Until then, we can lighten up a bit and slowly go back to normal.
And on that note of returning to normal, or whatever the new normal will be, Ontario also released yesterday their projections or their plans, in terms of gradually reopening in 3 stages, of course, with medical advice. So I'll get your thoughts on that plan that we heard about yesterday.
Well, I'm on the public health measures table that advised the chief medical officer of health on that. So I can tell you that we took a lot of time to looking at the criteria. Obviously, it makes sense that you're going to look at number of cases, number of hospitalizations, ability to contact trace, because we're still going to get one, even when we pull back, we're still going to get cases, but the trick is to identify them, and protect the vulnerable, continuing doing so, continuing our social distancing, continuing hand washing, mask wearing if required, but the stages are going to be progressive. The first stage, probably in 2 or 3 weeks' time, we're going to be looking at reopening some workplaces, more curbside deliveries, essential services, those type of things, increasing the number of people that can gather, maybe to 10. Wait 2 or 4 weeks, make sure that we don't have a big surge in admissions or cases. Follow that up with widening a bit more, perhaps maybe leaving 25 people in terms of gatherings, opening up some outdoor spaces and so on, and then progressively in a month of the time, progressively doing it that way. So it's going to take months before we go back to normal, but we're always going to be keeping an eye on, the number of cases, number of hospitalizations to ensure that we're on the right track.
And as you alluded to, just briefly to finish off, is throughout all of these measures, or all of these loosening of restrictions, hand washing, physical distancing is going to still be very important in terms of maintaining this flattening of the curve.
Very important. That we shouldn't lose sight of we're basing our pullback of these measures, assuming that we will continue with the current social distancing and hand washing, because that will be very important as we move forward. And like I said, it's going to take some time, but I think we're getting there, and people should know that there is a bit of a light at the end of the tunnel.
Excellent. Can't think of a better note to end on than that light at the end of the tunnel. So on that note, thank you so much for joining me, Doctor, for this update.
No problem.